Welcome back. Here with us on Urban Debate on Mirror Now. 4,041 new COVID cases were reported in the country in last 24 hours. In fact, in last 1 week, India has seen a surge in COVID cases. Following this, the Health Secretary of India has written to Principal Secretaries of 5 states, including Tamil Nadu, Kerala, Telangana, Karnataka and Maharashtra. The states have been asked to take prompt action and effective management to contain the infection. To understand how serious is the situation, I am joined by my guest this evening. We have with us Dr. N.K. Arora, Chair COVID Subcommittee of National Technical Advisory Group on Immunization. We are also joined by Professor Dr. K. Srinath Reddy, President PHFI. Thank you very much, both of you gentlemen, for joining us here on Urban Debate on Mirror Now this evening. It's always a pleasure to have you on the show. Dr. Arora, let me first ask you, what is behind the surge this time and specifically in the few states?
Thank you very much, Heena, for inviting. That's a very important point, both from a pandemic perspective, from a surveillance perspective, and also on the ground, the community's response in terms of both immunization as well as adhering to corona-appropriate behavior. So these 3-4 states which you just named, particularly Maharashtra. In Maharashtra also, most of the cases are concentrated in Mumbai. And then there are these other small clusters in the southern states you have mentioned about. The key concern at this time always remains whether a new sublineage variant or a new variant has entered into the community, and what is the profile of those who are getting infected. So the good news is that whatever from Kerala and from Maharashtra, this is we had a discussion during last few hours. There is no new subvariant, and one of the variant which the US and other European countries are worried are BA2.12.1. But fortunately, this is not a huge, there are only a couple of isolates for these. The other important thing is that in Telangana and Tamil Nadu and Pune in Maharashtra, during last 3 weeks, BA4 and BA5, few cases have been isolated. But tracking of these cases, contact tracing has not shown any a rapid spread of infection or symptomatic illness in these areas. So overall, the appears that we are doing a close surveillance, and there doesn't appear to be anything which should cause panic. Having said that, very important point is that this time in Mumbai, most of the cases are occurring in high-rise buildings, those who are immunized. We had seen a similar a surge of cases in Delhi. And in Delhi also, and Noida and some of the surrounding NCR region, children as well as adults were mostly from these so-called posh colonies or high-income groups, or the schools where outbreaks had occurred, they were also private schools. So it appears that it is sudden opening, lack of masks, social gatherings, marriages, markets, and the other economic activities. So that is why we are seeing. But you must see that the number of cases, although we had gone down to around less than 1,000 in February and March early, but it has gradually increased, and now it is between 2,000 to 3,000, and it is varying in clusters in different parts, but not there is a uniform surge. And I must tell you, program is keeping a very close watch, both from genomic surveillance as well as epidemiological contact surveillance.
Okay. Dr. Reddy, is the current surge a cause of concern? Can there be a correlation between the rise in COVID cases in the southern states particularly and the pre-monsoon showers or monsoon showers?
Well, the weather could play a role, but I believe it is far more important for us to look at these states as having not only higher level of urbanization, but a much greater mobility. If you just take the number of flights that are landing into these states, both international and domestic, you will find that there is a huge amount of mobility. And when the virus enters from outside, that is how it happens. So even within the state, there is a fair amount of mobility. You will note that the one state that has not been listed is Andhra Pradesh. And that is the state without a large international airport or very few flights operating. So there is definitely a correlation with the level of urbanization, industrial development, and mobility, particularly by air, but followed also by road transport. So monsoon and weather could play a role, but then Andhra doesn't seem to be that much affected. So the question here is, and we know that Delhi also is at this point in time seeing a rise in cases. Every time a new variant enters the country, or when people start letting down their guard and mingling and moving around quite a lot, it is the large metros which are most affected. And that's what we are seeing even now. That is to be expected. But I don't think there is a cause for alarm, because right now what we are seeing is that the Omicron family of variants, while they're acquiring greater and greater infectivity and possibly also higher levels of immune escape, they are not being very virulent. Their ability to penetrate into the lungs and to the blood vessels is far more limited than the Delta or some other variants. And therefore, we are not seeing the rush on hospital cases. And as Dr. Arora said, if it is the high-rise buildings that are mostly affected, we are really talking about the more affluent sections who have been extremely mobile after the COVID restrictions have been lifted. So it is a natural phenomenon that is happening, but I don't think there is a cause for alarm. But we should still go ahead and have COVID-appropriate behavior adequately prescribed and masks enforced, like the Delhi High Court has very clearly stated, because I think that is an important element of precaution that we must ensure that is being taken.
Okay. Dr. Arora, now out of 4,041 COVID cases that have come in a single day in India, 1,000 are coming only from Maharashtra. And out of that 1,000 COVID count that I'm talking about, 700 are coming just from Mumbai. Recently, we've seen reports of hospitalization rising among COVID cases in Mumbai. How concerned are you about the situation there specifically? And do you think the state should bring back the mask mandate? It's still not mandatory. People have been asked to wear masks, but it isn't mandatory.
So regarding the hospitalization, I must tell you, all over the country and even in Mumbai, where 700 or 800 cases are there, and during, this is the kind of numbers during last week or so. The important point is these are individuals who are admitted to the hospital for some other comorbidity. They might be admitted for cancer or for heart attack or for brain disorder, for liver disorder, and as a routine testing is done for COVID, and a lot of them have incidentally been found to be having COVID. So primarily, COVID leading to hospitalization, as Professor Reddy very rightly said, is extremely uncommon. And this has been the observation throughout this third wave. But certainly when an individual with comorbidity gets COVID, the outcome or the risk of severe disease and need for ICU care certainly increases. And so the whole question is, the important point you're asking is corona appropriate behavior and enforcing it. I think, yes, repeatedly for last few weeks, many of us has been emphasizing that corona is very much here. During last 3-4 weeks, we have got 2 new variants which were first described in South Africa, but they are all over. But in India also, we have seen their entry. And many of them do not have any travel history. It means it is already there. And BA4 and BA5. Fortunately, we don't see any spread there, but we need to be careful. There are other variants of Omicron, which can keep on coming. And therefore, as Delhi High Court has said, I think state of Maharashtra, Kerala, particularly these two states and the other southern states, they should enforce COVID appropriate behavior, particularly mask, and also restricting social functions. I think we behaved very sensibly during last 2.5 years, that all social gatherings, marriages, birthday parties, and other social gatherings really kind of disappeared practically from our lives. But now there is kind of a revenge kind of a thing, and we need to be more careful about this. Otherwise, the risk of infection passing on from one person to other person, and particularly those who have comorbidities, will always remain at higher risk of developing serious disease.
Okay. Dr. Reddy, any thoughts on the situation in Mumbai specifically, the rise in hospitalization there? And do you also feel there is a need to bring back certain COVID restrictions, at least in the 5 states that have been highlighted by Ministry of Health in the letter?
Absolutely. I think this needs to be strictly, and as I understand, there is going to be a meeting with the state leadership very soon, so that this message is passed on effectively, that the health system and the other administration should take care of this. Sorry, Srinath, I
Dr. Reddy, yes.
No, not to worry. Well, I would have said the same thing.
He gave us a headline, by the way. So I would like this kind of an interruption.
As far as Maharashtra is concerned, and Mumbai in particular is concerned, one must recognize that there is a large population which is highly mobile. And therefore, you're bound to get a large number of cases. And when the denominator of infected cases increases markedly, the numerator of hospitalized cases also will increase. So I do not think we should be terribly perturbed. We must take all the precautions. And let me state one thing about masks. People should not believe that masks are an imposition. Whenever cases rise, we ought to take the natural precaution of wearing masks in public places, crowded indoor places, so that we reduce the risk of infections to ourselves and to others. It is as commonsensical as people taking out an umbrella when it is raining. So when the cases are increasing, you take out a mask and then go out with your routine life. So if we actually take that principle, people should not see masks as an imposition, but as a natural precaution.
All right, Dr. Reddy, Dr. Arora, thank you very much, both of you gentlemen, for joining us here on Urban Debate on Mirror Now. And those are some very important points you have raised. The cases are rising and we all need to be extremely cautious and careful when we go out, because the vacations are also there and we need to be very, very cautious going forward. Thank you, both of you gentlemen, for joining us.